Good evening, everyone. Welcome to Bridging the Info Gap, PDA's bi-monthly webinar to inform you about all things PDA. I'm your host, Ward Blackwell, the Executive Director of PDA, and I'm happy to have a lot of people joining us tonight. Before we get started, we have to kind of explain how this works. As the nice lady who just introduced the webinar said, everybody who's an attendee tonight is in listen-only mode. You will not be able to open up your mic or turn on your camera. However, you can type in questions that will be answered by our panelists when we get to that point in the program. If you look at the top right of your box, there is a icon there, has a little question mark in it. That opens up the dialogue area where you can type in your questions. I will read them and direct them to the appropriate panelist when we get to that point in time. Just so you know, we will have a special Q&A fairly early on in the broadcast for our ADA guests. So if you have any questions related to ADA and the Delta Dental issue, go ahead and get those in early. Everything else will wait to the end to direct to the other panelists. Okay, with that part done, it is now time to recognize our sponsors for tonight's webinar. The PDA Member Advantage Program, which is all about adding value to your membership, is our main sponsor. They screen all sorts of companies to get you exclusive deals from the very best ones. For example, one of our other sponsors, Panacea, was created by healthcare professionals to serve the needs of their colleagues. And in addition to understanding your needs, because of that, they offer PDA members additional discounts on practice loans, student loan refinancing, and more, on top of their already competitive low rates. And if you're tired of paying high fees for credit card processing, you have to talk to Best Card. PDA members who are switching are saving on average just shy of $7,000 a year with Best Card. That's nearly 5 times what you pay in dues. Now, while that is sinking in, we will go ahead and introduce our illustrious panel for tonight. Starting off, our very special guest from the ADA Department of State Government Affairs, Mr. Chad Olson, Dr. Linda Himmelberger, who chairs the PDA Government Relations Committee, Dr. Jim Mancini, your president, Dr. John Coole, PDA president-elect, who we're hoping is, he has joined, Dr. Craig McKenzie, your representative on the ADA Council on Membership, and Dr. Nick Seigel, who chairs the PDA New Dentist Committee. That is tonight's panel. And with all that out of the way, it's time to get into the meat of things. Our very special guest, Mr. Olson, is going to be with us only during the first part of the webinar. We will have a special Q&A once he's done with his presentation. If you have any questions for him, please go ahead and start typing them into the question box now, because you'll get to ask him those and he will answer in about 10 minutes. Chad, take it away.
Thank you, Ward, and hello, everybody. Again, my name is Chad Olson. It's there on the screen, and I get the privilege of working in the Department of State Government Affairs. I get to work with PDA and all the state dental societies and territorial societies around the country on getting regulations and advocacy work and legislation done. And it is, as I said, a real privilege. I've been asked to talk today about a few things. The topic du jour is, if you go to the next slide, is regarding the, we're calling it payers limiting payment options and what the ADA's response has been. So as Ward alluded to, we have 2 companies that we know of so far that are looking at, I guess you'd have to call it a stick. You know, you have carrots and sticks out there. This is a stick method of encouraging dentists to go ahead and accept EFTs or virtual credit cards, trying to eliminate, it appears to us, the check option as something, the paper check option as something that is a payment option. And so we've heard first about, and that the reaction I'm going to talk, or the response I'm going to talk the most about, is the response to Delta's recent policy announcement. The policy is not put into place yet, but that policy announcement went out, and it covers all of Delta Dental of California and affiliates. Pennsylvania is one of those affiliates. And so there are also, besides California, Pennsylvania, there are 14 other states or territories that are impacted by this policy change by Delta. If you haven't heard about what the policy is yet, basically it is a fee that's required monthly, $15 for receiving paper checks if you are in network with Delta, is the gist of the policy. So how has the ADA responded to this? The first thing we did was draft a letter and send it off to the National Association of Insurance Commissioners. There is a body of insurance commissioners that gathers. They work on model laws. It's a very influential body, but we wanted them to be alerted that this sort of limitation on payment options was taking place, and push that at the national level. The next thing we did was an analysis of the payment option laws that are already on the books. We are close to 40 states that now have what we term virtual credit card laws on the books around the country. And as usual, you see one state, you see one state. There's lots of permutations on what these laws look like and the rights and options that dentists are granted when a law like this is passed. The paper check strategy that companies are undergoing, you could say that many of the laws just basically don't address this, or it's questionable whether they address this. And so I'm going to get to some possible state response later, but we do know that two states, one is Ohio, and the other is most recently this year, Utah, have a requirement that paper checks be offered without a fee. So those states are, kind of primed and ready to look more closely at this. But we did do that analysis, and we're looking at crafting a response based on the analysis for each state. So we did have a meeting with impacted states. PDA did participate in that with the state dental societies to talk about the ongoing strategy and kind of get some feedback from the state societies on the path forward. We just recently sent out a template communication to all of the states impacted that are in the DDCA, those 16 states and territory that I mentioned. We sent out a template for communication from the member to the Delta company. And so that is a template that it has the state society has the option of passing that on to their members. I know, for example, that Louisiana has already pushed this out. Louisiana is one of those states, but the message is basically, we find this an egregious and coercive action, and we're not happy about it, and we appreciate a response. So that's the template that was pushed out. We do have some forthcoming activities also, follow up with the NAIC. We sent that initial letter. I also sent them a scan of the different laws that I mentioned earlier, that analysis of what each state was doing currently. I passed that on to them, and we're opening the door to more communication with them coming up. And again, these are commissioners, so the heads of the departments of insurance in the different states. We have a template communication we're hoping to produce that would be to a member, from the members to their departments of insurance, to try and to also use that as an avenue of complaint. And then also finally a template communication from the dental societies to the departments of insurance, another letter for you all to use. And that would be specific to the virtual credit card law that you may or may not have on the books in the state. And then lastly, as I mentioned earlier, we have two states that have specific language about this issue. If we have states that are interested in pursuing further, maybe they have a virtual credit card law on the books and they'd like to add some clarifying language, we would be happy to assist them. Lastly, before I turn to other topics, I'll just say that on the issue of Aetna, that is it's a different approach. With Aetna, they are going to they're going to charge a fee for out-of-network dentists, and the notices have been going out. Again, it's that carrot strategy. We're still trying to get clarity from Aetna, we being the ADA, still trying to get clarity from Aetna. We've asked them a number of questions. We'll probably be doing a similar strategy to the one that I outlined earlier in communicating with Aetna as well. So with that said, before we get to the Q&A, Ward, also, if you can go to the next slide, which is just so, I like the fire. So just a few hot topics that I thought would be worth mentioning that Ward asked me to talk a little bit about. I'll start with dental insurance reform. I also already mentioned virtual credit card. That is a very hot moving issue around the country. The big difference, we worked with a group called the National Council of Insurance Legislators, and this past December, they amended their model law to conform more with ADA policy so that it's opt-in instead of opt-out. So what that boils down to is that a dentist would be notified about payment options, and it couldn't be just jumped into just receiving virtual credit cards. The insurance company would, perish the thought, have to ask the dentist first if they would like to opt into that new payment option if that type of law is adopted. So it was a nice win for us. We've seen 2 states this past year use that language to switch to opt-in. One was Louisiana and the other one was Georgia. Other issues that are moving on dental insurance reform include network leasing. That's, again, the ability of dentists to choose whether they want to be jumped into a new network to have their relationship leased. That, again, ADA policy changed. We're hoping to have more states go down this road, but the great news is that Colorado went with a opt-in for their new leasing law that just was passed this year. So exciting news on leasing. Again, it's, explaining to legislators how opaque this process is and how it puts dentists at a real disadvantage. We're making some real headway, and again, lots of laws have been passed already on leasing, but this is a slight tweak, and we're hopeful that others will join. Colorado and Oregon a couple of years ago did opt in on leasing. I don't want to not mention them. We also have assignment of benefits that's been moving, and we're at 30 laws on assignment of benefits around the country. So that's a real kudos to the work of the state dental societies. And we also have dental loss ratios still moving around the country. We had this past year a transparency law passed in the great state of Mississippi. I'll just briefly mention workforce issues. We have, it's called the oral preventive assistant that we're supporting in various states. And the good news is that many states are finding that they could actually make the oral preventive assistant, which, if you're not familiar with that, it's a position where a dental assistant is allowed to do supragingival scaling is the essence of it. And we are seeing states like Missouri and Nevada around the country take this up. And the good news is that some of them have found that they can do this without passing a law, and they just have to have the dental board be willing to take action on it. I'm going to stop there. I think I'm getting close to time, and I will pause for questions. Again, it's been a real pleasure and honor to chat with you tonight. So take it away, Ward.
Great. Thank you, Chad. Just real quick before we go to questions, a couple of points for the audience. PDA does have a DLR and leasing bills filed this session. We do have a virtual credit card law. Unfortunately, our law only requires there be some other option besides a virtual credit card. It doesn't necessarily stipulate it has to be a fee-free check as the other option. But we are using the template provided by ADA to urge people to contact the companies, and members should be seeing that sometime this week. So I do have a question for you, Chad. Interesting take here. We know that the biggest purchasers of these plans are large employers. So the large in-state employers who do buy these dental plans, what do you think of the strategy of contacting them about the payment issue?
Yeah, it's certainly worth thinking about. I often say, I think maybe Ward's even heard me say this, the plans are basically, especially in ASO, ERISA, self-funded arrangements, they're basically paid to be a buffer between the employer and dentists and the subscribers. And they fulfill that role very well. I think that, but again, you don't want to ever close a door on a possible strategy. I only say that because a lot of times contacting the employers themselves, they would throw their hands up and go, what are they even talking about? But it's worth pursuing. We talk about that a lot at the ADA, thinking about, is it HR? Is it the consultants that sell these plans? Who needs to know how onerous this is becoming? But the last thing I'll say is, maybe it is an avenue worth pursuing, because another point I like to make a lot is the employers are the true customers of the dental plans. It is not patients, it is not dentists, it is employers. And if you think about it with that lens, it makes a lot more sense how they behave. So I know that's kind of a mealy-mouthed answer, not specific, that I'm going to run out and do that, but it is something, rest assured, it is something we've been thinking about, and it's a good suggestion.
Yeah, I'm following up. I think it's definitely where the plan's bread is buttered, if you will, is with the employers. It's just, do they make the connection to what this issue and their own interest? That's a tough job for us.
Exactly.
I don't see any other questions for you right now, Chad. Let me refresh that real quick. Nope. Looks like everybody was astounded by your presentation. And I know you have someplace else you have to be.
I do. And I'll just say one quick last word. It's a pleasure to work with Ward and the team at PDA. And we talk often, and we look forward to working on any of those legislative issues that Ward mentioned, those bills. We're eager to support the actions of PDA to get stuff done on you all's behalf. So thank you all, and I'll go off camera and on mute. Thank you so much. Have a good night.
Thank you, Chad. Really appreciate you making the time to join us. And with that, we're going to pick right up on some more government relations stuff, but more close to home, and let our chair of government relations, Dr. Himmelberger, explain what's going on.
Thank you, Ward. If we could have the next slide, Michelle. Thank you. So great segue provided by both Chad and Ward. Those of you who were at the PDM, some of this will be familiar to you. We have 3 legislative priorities that we've identified for PDA this year. One is network leasing. The second one is dental loss ratio reporting and credentialing reform. We could go on to the next slide. So we have a network leasing bill that will be sponsored by Senator Argall. It has not yet been introduced. We're kind of waiting for the best time to jump in. And the way our legislation is written, the dentist can opt out or opt in to a network anytime that the contract is either signed, it's sold, it's leased, it's renewed, so that at every step along the way, as this contract is being revised, the dentist would have an opportunity to say, yes, I'll participate in that, or no, I don't want to. And there would be no penalties if you wanted to opt out of any particular network that the insurance company would want to lease you to. Next slide. All right, the next thing we're looking at is the dental loss ratio reporting. Now, I think you all are familiar with the fact that on the medical side, there's about an 80% ratio of premium dollars that are, or dollars that are paid out to patients for work that's done. That's the numerator. The denominator is the premiums collected. So the higher the percentage, the more benefits the patients are actually getting, because more of their premium dollars are going to pay for treatment. Right now, we don't know what the dental loss ratio is. And so this bill would be our entree, our foot in the door as to what is our ratio. We heard anecdotally that it may be only 60% or maybe less. So our bill would not require that dental insurance companies have a specific ratio, and it would include all plans that provide dental coverage, regardless of how many individuals are covered under a specific plan. And again, there would be penalties for insurance companies if they fail to comply. Next slide, Michelle. So one of the little bumps we ran into is that the insurance industry pushed back and said, rather than report ratios for all entities, they just wanted to report for large group policies, those that have more than 50 people signed up. And their assertion was that this would parallel legislation that Virginia had already enacted. Well, it comes to find out the reason the new bill in Virginia calls for plans that have more than 50 people is that they already had existing legislation for plans that are fewer than 50 people. So we are going to be lobbying against this particular insurance insurance amendment as we go forward with our lobbying efforts. Next slide. So last but not least is our credentialing legislation. This has been introduced in both the House by Representative Stephen Metzger and in the Senate, again, by Senator Argall. The insurers would be required to accept the CAQH application, which is a universal application. If the doctor who is submitting that application has an error, the insurance company needs to advise the person who's submitting the form within 10 days. They would also have to process that credentials request within 45 days. And again, there would be penalties for the insurance companies if they don't meet those deadlines. So that is the bill that we have pending right now in both the House and the Senate. We could go on to the next. So those are 3 pieces of legislation that the PDA has proposed. But I think it's really important to stress that the PDA, the Government Relations Committee, the Board of Trustees, our lobbyists, our government relations staff folks are tracking more than 50 bills which could impact dentistry. These are not bills that we've introduced. These have been bills that have been introduced on the behalf of other entities. So we are watching things very closely. Next slide. Just to give you an idea, these are things that have just popped up on the horizon. So we have House Bill 2712, which would seek to update the Peer Review Protection Act. It's been introduced and it's been referred to the House Professional Licensure Committee. And again, as it says, this would update the peer review process Protection Act to be in compliance with a judgment that was handed down by the Pennsylvania Supreme Court several years ago. Second bill, again, that just dropped last week was House Bill 2722, which would require dental insurance companies to use provider portals in order to update patient coverage and medical histories. The thought being that this would make it handy for dental offices to be able to check on coverage as folks are coming into your room or into your treatment office. We were contacted under DSO legislation. We were contacted by a member of the House who is working on putting together legislation that would put guardrails up for DSOs and how they would be able to run their businesses within the Commonwealth of Pennsylvania. You may know that Colorado, I think within the last week or 10 days, has passed legislation that would limit DSOs to providing support only in the areas that I would define as the business areas. So the billing, insurance, all of those sorts of things. There is no legislation yet. It has not been written. We are on the ground floor with this. I would note, not surprisingly, that in Colorado, where, as I said, this legislation just passed, within about 48 hours, ADSO, which is the Association of DSOs, filed a lawsuit claiming that the legislation was unconstitutional. So we'll have to see how all those things play out as we're going forward with anything here in Pennsylvania. Last but not least, the dental board has been working on regulations governing mobile dental vans. That was first proposed when I was on the state board in 1995. We now have, 30 years later, what's called annex regulations. These are the rough draft. And this rough draft of these regulations put forth by the state dental board, not the legislature, but the dental board, are being circulated to the parties of interest so that we all have time to make comments on these regulations before they go on to the proposed stage and then the final stage. So we are just at the beginning of this regulatory process with the mobile van regulations, but we are collecting feedback on these regulations. Sorry, somebody's calling me that's labeled as spam, so we'll get rid of them. Next slide, please. So I just want to wrap up by reminding you that the midterm elections are taking place on November 3rd in Pennsylvania. The governor is up for election or re-election. All of our U.S. Congress people are up for election, not our senators, but our representatives. All Pennsylvania House members are up for election, and 1/2 of our Pennsylvania State Senate members are up for election or re-election. So let me just leave you with this final word. Next slide, Michelle. Vote. It's important. If you like the way your legislator votes on dental issues, go out and vote. If you don't like the way they vote on our dental issues, go out and vote. We need to be part of the process. Thank you.
Thank you very much, Dr. Himmelberger. lot to cover, even though the legislature is not working all of August, probably back in the district campaigning just for that reason. We're going to shift now to our president, who has a couple of different updates, one on something that just happened and one on something coming up in the future. Dr. Mancini.
Thank you, Ward. Hi, everybody. Just wanted to share some things with you. For those of you that do not know, that is a beautiful picture of the city of Pittsburgh. Why is that there? Because the Pennsylvania Dental Meeting, which is an opportunity for the dental community to come together for continuing education, discussions, and camaraderie, is coming to Pittsburgh for the first time in 130 years. That might be an exaggeration. So it's going to be April 9th and 10th of 2027 at the Omni William Penn, which is in downtown Pittsburgh. The annual steering committee is finalizing the schedule, the speakers, the topics of everybody. That work is still ongoing. I can tell you that Ankut Gupta and Ashley Clark will be there on Saturday, the 10th. But like I said, we're still working on the schedule. If you've never been to Pittsburgh, if it's been a long time since you've been to Pittsburgh, it's a great city. I mean, this is where I live. We have a lot to offer. If you bring your family, there's many things for them to do. We have the Heinz History Center, the Phipps Conservatory and Botanical Gardens, the Duquesne Incline, which goes up and gives you a beautiful view of the city, the Andy Warhol Museum. We have the zoo and the Children's Museum, a couple of places to eat, the Lucas Diner, which has been on Travel Channel, and of course, Permani's, which has been world famous. And I highly recommend having French fries on your sandwiches. We're looking to try to have some kind of a Thursday night reception in somewhere where you can actually get a good view of the entire city. That again is being worked on right now. So I hope everybody comes to that meeting and enjoys all that Pittsburgh has to offer. The thing that just come up was we had our PDA board meeting on July 31st, and one of the things that came out of that was a discussion about the PALM program. As you can see, the consultation time has been increased to 60 minutes. It used to be 30. This is a fabulous, fabulous member benefit. And I urge everyone, if you need to have just a basic conversation, some legal matter, this is a great, great member benefit. And I urge you to take advantage of it. That's all I have, Ward. Thank you.
Thank you very much, Dr. Mancini. And yeah, just to kind of tag on to the PALM program there, after that free now hour-long consultation, if you need actual like full representation as opposed to just getting a question answered, you can also get a discounted rate on legal services through the program. Same rate that the PDA pays with our firm. So yeah, a lot of benefit there, regardless of your legal need. With that, we're going to now go to our president-elect, Dr. John Coole, who recently visited the ADA and has a report for us. Dr. Coole.
Good evening. Yes, I had a wonderful opportunity to go to Chicago. I've never actually been to Chicago, so that was a nice welcome. Got to hang out with Ward for a couple days. So, at the conference, one of the most important things that came out of the President-elect conference last month was more proof that many of Pennsylvania's issues are really nationwide issues. Speaking with other president-elects, the conversation came back to several different issues. Insurance reimbursement was a large topic, like it is for everybody. Pennsylvania is in the bottom tier of states as far as reimbursement is concerned. This is obviously a gigantic hindrance to new dentists trying to start out. We've all talked many, many times about all the debt that they've already accrued. And they almost seem like they speak like they feel it's impossible to start a practice of their own. And there are statistics to show that DSO percentages are growing as a result of the pressure they feel because, quite frankly, the insurance rates haven't changed in, quote, whatever number you want. It's been essentially forever as far as dentists are concerned. I practiced for 28 years and I don't think they've ever changed. Most of the people I talk to seem to have some of the same rural care issues. Some as simple as dentists retiring without being replaced, difficulty just finding associates if they want associates, and the general workforce issues we all face in some form or another. Some states have EFTA level employees and others doing part of their ProCrew services, as they talked about earlier. It seems as if some of these states were willing to lower or make it easier for care to be provided. I'm not sure this is a great answer, but maybe some care is better than essentially no care at all. So we did get a chance to speak to the legislative team that Mr. Olson's part of. They spoke to us for quite a while. They spoke less about specific goals and really more about how to get everyone to participate. Our national dental population is fairly even divided between the two parties, and that's what I think is a good thing. They emphasize that any issue that you or I may have is most likely shared by many. Bringing your issues to your colleagues and you will find out you are not alone, no matter how small the issue is. And just getting groups together on issues strengthens the association and our chances of finding a favorable legislation, or at least having a bulk group of people asking for similar legislation. So along with that, contributing to the PDA PAC, especially with hard dollars, is our main way to influence legislators. Even the smallest donations add up if more get involved. No legislation can be made or legislation defeated without some sort of a team effort. Nobody does legislation all on their own, obviously, and they emphasize that. We also heard a nice presentation by the Forsyth Institute, which is the ADA scientific division. Forsyth Institute is in the top 3 institutions receiving the most federal research grants, which is a big deal. That's a lot of money. They seem to be a powerhouse for the reputation of the ADA. As everyone knows, the ADA seal of acceptance is a valuable tool to organize dentistry and to push our organization further and keep our importance in the news. But all these conversations got back to the same themes we deal with all the time with our organization. Utilizing large groups of members and their PAC donations to guide legislation, getting dentists together to discuss their issues and having them realize we are better as a group helping ourselves than fighting issues alone. And finally, the ADA Forsyth Institute proves we are on the forefront, encouraging more research to make dentistry better for all of our future generations. So when people ask me about why to join the ADA or the PDA, these are commonly the issues that I refer to repeatedly. And that's pretty much my whole report. Thank you.
Thank you very much, Dr. Coole. It was only a couple days in Chicago, but it sounds like you had plenty going on.
Yes.
Yeah. I know someone else we got on the panel tonight has plenty going on in Chicago. That's our council and membership representative, Dr. Craig McKenzie. And Dr. McKenzie, what's the council up to?
Yeah, great. Thanks so much. And John, I appreciate everything you brought from the President-elect's conference. It sounds like it's very similar to what the ADA Council membership's been discussing. So the council recently sent 2 proposals to the board. The first one was about our group practice model, which would have created a new pathway for becoming an ADA member. So as we all know, large group practices, as we've discussed on this call, have become fairly common, especially over the past couple years, especially with new dentists spending their first couple years in a large group practice prior to going to a private practice model. So in this model, large group practices would be able to join the ADA as a group, providing all employees automatic membership in the association. And again, knowing that new dentists especially are attracted to these large group practices for the first few years after dental school, the council found this to be a innovative way to keep dentists as members as they transition from dental school to a large group practice and then eventually onto a private practice. This is not for those super large, like mega group practices with thousands of dentists. Quite simply, those large groups weren't interested, but this model was targeted at those large group practices with, say, a couple dozen to up to 100 employees. The second proposal that we sent to the board was the council's response to resolution 2025-215. That was the new dentist graduated dues structure. There was significant discussion over the dues discounting in many states, with California and Illinois feeling that their states had programs that were very beneficial for recruitment of new dentists. California, as an example, had a very long graduated dues structure of 10 years of phased increase in dues, while most states like Texas, Illinois, proposed a shorter on-ramp of 4 to 5 years of discounted dues structuring. Discussion was mixed because there's significant financial impact to the association, and it would be financially difficult for smaller states to shoulder the burden of subsidizing an additional discount. And it is important to note, though, during this discussion that regardless of what model is chosen, if a dues discount model is chosen, that the steepest drop-off in membership occurs when new dentists have to pay any dollars towards membership. So when it goes from 0% to any percentage of discount, then there's going to be a large cliff of drop-off of membership. Ultimately, the board sent both of these proposals back to the council with 2 main messages. One was that the membership model has to align with the limitations of our IT infrastructure with Salesforce Fontiva. And then, of course, while we know that cost is a significant decider of whether dentists join the ADA, the other feedback from the board was to focus on the value of membership. Therefore, the council voted to create a work group on comprehensive membership strategy focusing on membership value, including not just new dentists, but mid-career and retiring dentists, specialists, and dentists in all practice modalities. Next, in response to resolution 2025-225, which this had to do with the reimagining of the IDL, the council identified the American College of Dentists as a potential partner to develop a leadership training program with for dentists to prepare them for roles in organized dentistry. The proposal for the ADA to work together with the ACD also was just sent to the board, and we're awaiting feedback from them. Last but not least, the council continues to work on the institutional membership model for dental schools. Currently, full-time faculty members have one of the lowest market shares of all of the cohorts in the ADA. Faculty opinions, of course, and their involvement in the ADA directly influence dental students' opinions of organized dentistry. With the main reason faculty not joining the ADA are cost of membership, the value that they perceive that the ADA offering versus what they already get from their organization, ADEA. This work group has focused solely on the value that the ADA could provide faculty members, as well as the value that the ADA could provide to institutions as well. Membership would be a per institution fee to cover all full-time faculty members as defined by the institution. And it's important to note that dental schools are already familiar with this model of membership since auto-enroll schools with ASDA already pay a single check to the American Student Dental Association to cover all of their students. with ASDA membership, and then they also pay a single fee to a DIA to cover all of faculty members in a DIA. Of course, members are always welcome to contact me if they have any questions about the council's work. And with that, that concludes my report.
All right, now we're back. We can see you, Craig. Excellent. Really appreciate that. I may have a question for you later, so definitely stay around. But we're going to move on now to our new dentist committee report from Dr. Nick Seigel.
Hello, I'm Nick Seigel. I'm the chair of the new dentist committee for the PDA. Can you click to my next slide there? Perfect, thank you. So we are approaching that time of year again. We are welcoming in a new class of dental students, and this will be the class of 2031. And over the next couple weeks, we are sending out members of the NDC to all of the schools in Pennsylvania, Penn, Pitt, and Temple, to personally welcome these students into dental school, and to also introduce them to the Pennsylvania Dental Association. Last Bridging the Info Gap meeting that we had, I mentioned that the NDC was looking into hosting another CE webinar, and part of the driving force behind this was to offer everyone a CE course that they can have access to off of the PDA website, and they can view it on their own time frame, basically addressing the bit of Zoom call fatigue that we've been having lately. So I'm happy to announce that at the most recent NDC meeting, we voted on our topic, and that topic will be Botox. We have not had a Botox CE hosted since 2021. And when we did that last time, it was a very well-received course and a very highly attended course. We've had a few requests over the past few years to do another facial injectables or Botox course. And we are always happy to give the people what they want. So we are working on getting that set up. Keep an eye out for the date when this webinar will be hosted. You can still attend it live. And then we will also be posting it on the PDA website. It will be sometime in 2027, but that will be here before we know it. So sit tight, and that's the main piece of my report, is that we have Botox CE coming your way. And that's all for me, Ward. That concludes my report.
Short and sweet, but important stuff. Thank you very much, Dr. Seigel. All right, with that, we're actually a little early on where we normally would be at this point, but that's not bad. We have plenty of time for questions. I do have one already typed in, but I would encourage all the attendees, if you have any questions, go ahead and type them in. We'll give you a minute or two to do so, and be happy to have any of our panelists answer those questions for you to the best of their ability. Right now, we'll go ahead and take one, though, from Dr. Scott Aldinger. I believe this is directed to you, Dr. Himmelberger. It's relating to the DLR bills. Do those requirements to be transparent with loss ratios apply in any way to the small plans operated by dentists for their own patients? I'm assuming he's referring to in-office membership type plans.
I don't believe so. I think these are plans that are run by insurance companies, not in-office dental plans that a dentist might put together.
Yeah, and if I recall, in general, if those in-office membership plans have been set up according to the format that everybody's encouraged to use, that does not meet the definition of a dental benefit plan in law. Most states have shared that information pretty well. So I would agree. I can't think of a scenario in which suddenly that one law would apply to those kinds of plans, and whereas none of the other insurance laws do. So good question, though. Thank you, Dr. Aldinger. Not Yeah, there's another one from Dr. Ted Rockwell. Like this one is for you, Dr. Seigel. How many CE credits will the online Botox course be?
I believe it will be 2. But once we announce the exact date on when that course will be posted, I will have an exact number for you. But I should say it'll be at least 2. I'm not sure of the exact number though. So yeah, stay tuned for that information as well.
Okay, thank you. Don't see any other new questions, although we'll give you a minute to type up. Dr. Rockwell's very appreciative for that answer. Anybody else has a question? Got a couple minutes to type it in while I direct one question to Dr. McKenzie. Craig, you mentioned several initiatives that had been essentially discussed by your council and you'd gotten feedback from the board relating to that, such as the on-ramp for dues and the institutional membership for dental schools. Do we have any timeline for potential implementation for those that you can share?
Yeah, so that's been a kind of a point of contention, especially on 215, the on-ramping of new dentist dues. So whether or not that goes, I think is ultimately going to be left up to the states. I don't believe the council is going to bring anything as far as new member like graduated due structure to the House this year. But if I was a betting man, I would say that Illinois for sure is going to bring graduated dues to the House of Delegates this year. And with all of the research that the council has done before we did send our initial plan to the board, that all of that information will be available, and the council is available to talk with any state that is considering submitting a proposal. As far as the other ones, at this point, there's nothing going to the House this year. But hopefully there'll be more concrete plans here by our next council meeting.
Okay. Yeah, I kind of expected that answer. I will say I know that the PDA board has been briefed on the on-ramp proposals, including the one that came from Illinois, and are generally supportive. So I would be inclined to think Illinois is going to introduce it, and it's very likely the House will wind up supporting some version of it.
Yes, and I think California and Texas are probably going to submit something too. Again, California has that 10-year on-ramp, which has much larger financial implications for the association as a whole. But I mean, I agree with you, Ward. I think at some point, some shape or form of this is going to be brought to the House by one, if not many states.
Yeah, that'll just be an interesting debate to figure out how everybody settles on one model. Because we all don't have the money California does. Okay, I see another question has popped up here from Dr. Graver. What is the discounted cost for the legal advising program once the hour has been surpassed? I believe it is now $3.50 an hour, Dr. Graver. I'm about 90% certain of that. I can tell you what, though, we will email you a confirmation of that. And it may actually be posted on the website, but that's my recollection. Okay. Do we have any other questions here? Any questions from one panelist to another panelist? All righty. Oh, that looks like it. I'm going to say then we might just let everybody get to their dinner or evening plans a little bit early tonight then. I'd like to take this opportunity then to thank our panelists tonight. It was some very informative time we spent, and it's great to hear all the things that are going on that all our volunteers are doing for their colleagues. A reminder to everyone that we do have a recording of every one of our webinars saved on the webinar and video library on the PDA website. Tonight's is there. You can share that information with your colleagues. If you think there was something valuable you got tonight that they should see, let them know. They can go see it on that library, and be sure to look at past webinars there where you can get information that was covered previously that may be very interesting to you. With that, we hope everybody will join us again in 2 months. The next, as I said, of these webinars are bi-monthly. The next one will be October 5th, same time. And because it's alternating between Mondays and Tuesdays, and we're on Tuesday, that one will be on a Monday night. Just try to change up a bit so more members will have an opportunity to see. Hope nobody objects, but we're going to wrap up early. Have a wonderful end of the summer. We'll see everyone in the fall.